Beyond things like topical therapies, when do you decide to move to systemic treatment?
Yeah. So we use systemic therapy if we see other organ involvement. So it's really organ specific. So the most common other thing that we'll see with Sjogren's will be joint pain. So inflammatory arthritis, which is inflammation and stiffness and swelling in your peripheral joints, in which case we can add systemic therapy. We also use it for other organ involvement. If I'm noticing, hematological involvement, lung involvement, renal involvement, neurological involvement. But I'd say probably the number one reason would be most commonly in Sjogren's is going to be inflammatory arthritis.
So, how do you decide between hydroxychloroquine, methotrexate, and mycophenolate? Um, are there specific systemic symptoms that you look for? What's the
Yeah,
process?
those are all great drugs and all we use in their own particular avenues. So hydroxychloroquine is something I would definitely use a lot in Sjogren's. It works quite well for more what we call skin and joint manifestations of Sjogren, so I may pick it for that type of person. Methotrexate, great option as well. Again, used for more skin and joint, but also has some benefits in other avenues of Sjogren's. And then mycophenolate is also a great drug. We would use that for more someone who has more organ involvement, which is going to be like renal involvement, so kidneys, lung involvement, and we actually even do the combination of all of the above. It really depends patient to patient, but most of my Sjogren's, I definitely probably having a conversation about any of those medications depending on what organ is involved for them.
hmm What's your approach to treating fatigue and other things like that? Things like neuropathic pain, symptoms that often frustrate both patients and clinicians.
Yeah, these are great questions because they're very typical for what I encounter daily in my clinic. So fatigue is probably one of the most common symptoms someone with Sjogren's or even with any systemic connective tissue disease will report. A lot of my conversation is first trying to definitely address their autoimmune disease and make sure it's under control. Because if you have high inflammation in your body, you will feel fatigued and not well. So I have to make sure that as the physician, I have that under control.
hmm
Then I usually have a conversation about my patients. Well, okay, what are other things that cause fatigue? It's usually multifactorial, which means multiple things are involved. So we address their sleep. Are you sleeping well? If you're not sleeping well, what can we do to make that better? We address mood. Mood disorders are not uncommon with autoimmune disease due to chronic pain and the complexity of chronic illness and other what I call like factors that are modifiable. So blood counts. Are you anemic? Do you have vitamin deficiencies, vitamin D, B12, folate, and addressing those topics as well. And I always tell my patients, I wish there was like this thing will fix everything, but it's not that simple. So having a conversation about these are the most common reasons for fatigue. Let's go through them one by one and see if we can help address them.
hmm